Cool, so this is also quite a good angle. This is a different desk. My name is Rosamina Michael, and I did kind of like an introduction the other day on my psychology channel. I wanted to talk specifically about major depressive disorder. So there is a difference between criteria and symptoms. Criteria, my understanding of criteria is if you were to go to a psychiatrist and you were to say, these are the things that I feel and these are the things that people see, for example. And then she would tick. And then the symptoms are also things that people see, but it can be on the normal spectrum of personality. And symptoms would be how you would act out something, like how it would show, how the disorder or the mental illness would show in your behavior, accustomed to it being a criteria. So if you had flu, it would show in your face aching, so mucus accumulation. So people on the outside cannot see you have flu. Maybe the people at home can see that you have flu, but people, when you walk into work and when you're at work, they can't necessarily see you have flu. But the symptoms is that your body aches. Symptoms is that you have postnasal drip, all those things that cannot necessarily be seen. So that's how I would understand that you would say, okay, this and this and this is how I feel, this is what people see, and the doctor would look at the criteria and tick 5 of the 9 or 8 of the 9 or whatever the case is. So that is kind of the difference. I don't think it's necessary to fully know the difference between criteria and symptoms. I don't think it's important to self-diagnose either, because you're not a psychiatrist. However, I would say that if you're feeling in your spirit like something's not right, if you're feeling like you've got this sadness that just won't go away and there isn't a real reason to be sad, if you've got certain ailments that you feel, because in my opinion, a lot of the time you would feel it in your spirit, like something's just not right. But if you cannot see it and somebody keeps saying to you, dude, you're thinking black and white a lot, eh? And dude, you're doing this a lot, eh? And dude, your memory is bad, hey? I would read up on that sort of thing and go to a psychiatrist and say, okay, so this is what my friends are seeing, this is what I feel, something's not right, I just don't know what it is. That is what I'm talking about, like reading up on what you think it could be. So I also want to be careful on this. Do not go into the hypochondriac kind of direction or the neurotic kind of direction where you self-diagnose all these different things. Also, I do think track your behavior. So is it a pattern? Because mental illness is a pattern. People in general are patterns, but you get healthy patterns and you get abnormal patterns. And so what I'm saying is track that pattern. Okay, so write everything down. Okay, and then another point that I want to mention is control. So, for example, if I'm menstruating and I'm moody, I can control that to a large degree because I can see, I'm irritable over stuff that I'm not usually, because actually my personality is an optimist. And so when I get irritable over small, stupid stuff, that's when I know something's not right. But I also know that it's going to last 2 or 3 days and it's going to pass. So I can choose to, you're just more self-aware of it, and you're more aware that, like, instead of saying, why are you doing that irritably, you could, because normally it would be something that wouldn't bother me. I'd notice it, but I'd let it go. So I'd notice certain things, but I just don't talk about it. And I just learned to be more self-aware of the fact that I'm more irritable. And on the flip side of that, I do also want to mention that you're allowed to be irritable over things that bother you, like big things, okay? So you do, I do connect life, things that happen and things that happen in relationships to mental illness. Because external things do influence mental illness in the person, okay? And then it also influences the person or the people that are immediately affected because you're around this person with mental illness, okay? And so there are certain things that I do feel like you can be passionate about and you can be against, and you can feel like you need to put down boundaries, okay? And I think, I do think we can choose to be nice in the way that we express ourselves, but I also do think that with mental illness, sometimes you need medication to help you balance those emotions because of the chemical imbalance in your brain. And sometimes you need talk therapy to say what you're needing to say and get out the passionate way that you feel about something. So I do think where you channel that passion is necessary, and I do also think that if you're angry with somebody, write it out maybe first in the dear diary before you release that wrath toward the person, because some things are worth getting passionate about or aggressive, and some things might not actually be about the other person. It might be projection. And I know a lot of the time with mental illness, with mood dysregulation and with personality split, there's a lot of projection and there's a lot of wrath thrown at people that actually don't deserve it. This is partly what causes the conflict. The acting out and things like that is what causes the conflict with the people around you. Okay? And this is why I say it is important that if you feel like you're anti-pornography and you feel like you're passionate against it, and the more you research on the topic, the more angry you get over it. You're allowed to be, okay, angry over whatever topic, human rights, racism, animal cruelty. You're allowed to be upset about stuff like that. How you handle it is what matters. And so that's where I do think where you can practice self-control, do dear diary, maybe speak to your therapist before you go up to the person and be like, how dare you treat the animal like that? Because number one, have you asked the person questions? Number two, do you know the context or the person or anything like that? You can't just release your wrath because you're angry, because then that's about you and not necessarily the situation. But on the other side, I do not think it is okay to feel like you cannot be aggressive and passionate about certain topics like animal cruelty or like pornography. If in order to say fit into society, where people would say don't talk about things that bother you, or we don't talk about politics, we don't talk about religion, we don't talk about this, anything that will make other people uncomfortable, don't talk about it. And people would joke about pornography and people always joke about marriage. The step after marriage is pornography, and it's actually like things like that you're allowed to disagree with. So some of these things are things that I disagree with just through reading and getting older and realizing this kind of thing I don't think is okay to laugh over. And then keeping in mind something like pornography, for example, some people are for, and it's not, they're not religious in any form, okay? And as in the person isn't, and that's also okay. So where, for example, with pornography, if it gets brought up, I've got to see the context. These people are maybe for it. Maybe you've even got a couple of porn stars in the room. I don't know. So you can say you disagree with the field of work and you're religious and or you're just strongly against it because you feel like it's against everything women stand for. If you're a feminist, for example, anything, I don't know. Or on the other side of that, because with the sex industry, that is legal in many places and many people choose it. Even if it is driven by money, many people choose it. And so on the flip side of that,